It's really great to see you, Henry Charles Reginald III. I see that you are here for your home appointment, and I'd just like to say how really charming it is in this home of yours. It really is lovely. You've done an amazing job making it look so nice and friendly. Does this sort of thing take long? Okay. You've booked in for a home cranial nerve examination visit today, and you get special privileges as you are a patron of the doctor's surgery, and of course you paid lots of money, so you don't have to actually go in, and you can actually have a private doctor as well. Yeah, so I am of course your private Dr. Henry, and have you had a cranial nerve examination before? No, you haven't had one. Okay, well, it's going through certain procedures and going through little tasks, and it checks neurologically the upper part of your body as well as mid and a little bit lower as well, and all these little tiny details, and these could be very trivial in nature. Okay, and basically everything with your face, with your cognitive abilities, is all functioning properly as it should. It's a very basic sort of examination. Could be quite sleepy as well, but all it requires for you is for you to just get a nice comfortable chair so you're sitting upright. Okay, not to worry, I'll wait. That looks like a very comfortable chair there, and now you're sitting upright. What I'll ask you to do, if you can just sit there, be relaxed, and try to follow every instruction which I give you to do, and this will really help with your examination. Okay, Henry, thank you. So I know that it's one of those slightly disappointing things, and you don't look incredibly enthused about what we've got to do today, but I assure you, for someone like yourself who pays an awful lot of money just to get a private doctor, then yeah, these are the things that you want done, and then you could search out things if need be. I don't suspect there'd be anything like that. So Henry, if I can just take down some details. Don't worry about responding. The facial expressions are also fine. Okay, so just take down your full name fully. Just say I'm here, Henry Charles Reginald. Is it Reginald? Regibald? Reginald, okay. The third. Okay. And your house address, please. Yeah. Don't worry, that blank stare tells me everything I need to know. Of course, I came to your house, so I do know your address, okay? And it's a charming place here. Little aeroplane flying above, probably a no-flight policy, so no overhead, I thought, in the far quiet area. Okay, that's there we go. Address it in, and in for the cranial nerve examination. I'll update all of your cranial nerve examination on here as we go along, and I'll get it sent to you. Or not, of course, that's perfectly fine. So, what I'm going to do is just put on some gloves here, and I'm just going to come in a little bit close and just begin with feeling your face. So I'm going to be doing gentle taps here, gentle taps there, and if you just look directly at me, if that would be, yeah, is that okay for you there, Henry? Not to worry, no, that's fine. Okay, so if you fall asleep during the process, that's perfectly fine. Henry, Henry, sorry, I didn't expect you to fall asleep straight away, but that is quite impressive. So as I was saying, if you can just follow the instructions, I'm just going to be doing some facial taps. Okay, so. And now does that feel? Does that feel about the same in pressure? Good. About the same, great. If I do a line there, how does that feel? About the same. Now what if I do that there and that there? How does that feel? Just keep answering and following. Yeah, that's great, you've got it there, Henry. Again, if I just go like that, and if I just go like that, how does that feel? About the same. And if I go like that and like that, how does that feel? About the same. What if I do that and that? A little bit, yeah, a little bit stronger than that one. What if I do that and that on the side of your face there? Any different? That one's a little bit different. Yeah, that's fine. So, one more, that and that. Great. Now I'm going to ask you to do some facial movements here for me, Henry. Okay, what I'd like you to do is, well, you're doing a good job at frowning right now, but if you can just lift up your eyebrows there for me, and I'm just going to try and push them down, okay? So, lift them up, fight, that's great. Now I'd like you to try and pull your eyebrows down like you're frowning. You're doing a great job at doing that already. Okay, and I'm just going to try and lift them up, okay? So, fight. That's really good. I'd like you to open your mouth nice and wide, like you're surprised. Okay, and then close your mouth. Okay, clench your teeth, like this, clench your teeth. Keep clenching your teeth, that's great. Now, I'd like you to open your mouth. I'm going to try and resist and push your jaw closed, okay? So if you can open, I'm just going to fight. Okay. No, that's fine. Okay, now I'm just going to try and open your mouth. If you can try and keep your mouth closed, okay? So if you can do that, fight. That's great. Almost looked like he was going to bite my fingers there. Okay, so what I'd like you to do, if you can just look to the left for me, then I'm just going to try and resist that. Okay, and if you just look to the right for me, and I'm just trying to resist that. Okay, thank you. Now I'd like you to look up there for me, up in your lovely cobweb-filled ceiling. Quite delightful. Okay, and if you'd like to look up, that's fine. And I'm just resisting that for you. That's really good. And same again, I'd like you to look down, and I'm just going to lift up your head gently and try and resist that there for you. So if you can look down like that for me, and I'll fight. That's great. That's really good. Now what I'd like you to do, I'd like you to look directly at my nose. Can you do that? Well, you're doing a superb job, Henry, at that stare. Really, it's quite an intimidating look that you've got there, but very concentrated also. Right. Oh, Henry, you've appeared to have fallen asleep again. Henry, it's remarkable how you're able to just relax like that and switch off. Quite a talent, gift you have there, Henry. Sorry to disturb you from your slumber, but if you're able just to look directly at me there, now I'm going to move my fingers around like this. What I'd like you to do whilst looking directly at me, Henry, can you do that? Yeah, that's great. Well, like a predator and a hawk. Okay, yeah. So if you just keep looking at me, and I'd like you to just get your finger in one hand, tap your nose, and then tap my hand wherever it goes, and we'll speed up as we go. Okay, that's great. Keep that. Yep, that's great. Perfect. Well done, Henry. You're doing a really good job there, Henry. Perfect. That's great. Well done, Henry. Yeah, perfect job. Keep looking directly at me. Now it's going to get a little bit faster. Henry. It's going to get very fast now. If you can keep doing it for me, well, my goodness, you're very good at this. I've never seen anyone do it so fast. It's almost as if you're trying to rush me through this as fast as possible, Henry. Okay, you're doing really good. Wow, this is perfect. That was very good there, Henry. Congratulations and well done. Okay, so what I'd like you to do is just close your eyes for me. And then try not to fall asleep. No. Oh, sure. Yeah, that's it. Have a smoke if you wish. Yeah, a lovely cigar there. Of course, Henry. Normally patients don't do that, but if you feel like that's going to relax you and help you along with this cranial nerve examination, just do that. Okay, so what I'd like you to do, if you can close your eyes when I say, and just tell me how many fingers I've got holding up when you open your eyes, okay? So if you can close your eyes there for me, okay? Open. What do you see? 2. Great. And close your eyes there for me. Open. 1. Just get rid of all that cigar smoke there. Might make you see a little bit better, okay? Okay. If you can open your eyes, how many do you see? 6. Excellent. Close your eyes. If you can open your eyes, how many do you see? Great. That's good. Close your eyes. If you can open your eyes, and how many do you see? 10. Excellent. Thank you so much. So I'm going to make some soft marks on various parts of your body, starting up with your cranial, and then we're going to move cranium, then move down. Okay, so I'm just going to extend this out a little bit. Okay, and all it requires is for me just to do a little movement on your face there. Okay, great. So it's about, if each side feels the same, okay, it's going to feel a little bit smooth. You feel that? Yeah, okay. Okay. Does that feel about the same? Great. You're doing very good, Henry. And what about that? And there, and there. About the same? Okay. What if I do that? And what if I do that? How does that feel? About the same? Great. And if I go like that? And if I go like that? How does that feel? About the same? And if I go like that there? And if I go like that there? How does that feel? About the same? And if I go... Not to worry. I'll pick that up. No worries. Must have just slipped out my hands there. Okay, well, it looks like that's looking fine there. So what I'd like you to do is just to place your hands out like that. I'm going to make soft touch on your hand there. Okay, just look directly at me. Okay, if I put a line down there, if I put a line down there, so feel about the same. Good. And if I tap there, feel about the same. Okay, what if I just tap there and tap there? How does that feel? Similar. Okay, and there. And there, how does that feel? Similar, you're doing really good. Well done. Okay, so what I've got is a little torch here. Now I'm just going to shine this on your face. Having a close look here, having a close look, close look, close look. Just going to have a close look here, Henry. Just looking at all of your face. Okay, I'm just going to move little parts of your cheeks here, across the forehead where your muscles move. Not like you just to smile for me. If you can, of course. I mean, if you can't smile that much, don't worry about it. But just smile just as much as possible. There we go. Okay, and keep smiling. Okay, that's good. Well done. That's good. Now I'd like you just to close your eyes a little bit there for me. Okay, just feeling at the top of your head there, top of your head on your forehead. Okay, that's great there, Henry. Well done. So what I'm doing is just updating all that we've done thus far. You're doing really, really good, Henry. And don't you worry, we'll be over very shortly. I'd just like to say how hospitable you have been. It's really nice when patients invite me into their lovely, lovely homes. It really is lovely to see such lovely place which they live in. In this case, you is quite delightful. Okay, so there we go. Excellent. That's looking good. So next up, Henry, what I'm going to do, I'm going to be making some soft sounds in your ears. Okay, what I'd like you to do for me, Henry, is just to tell me if these soft sounds sound the same volume in both your ears. Can you do that for me there? Great, I know you can. Okay, so I'm just going to get some items here. Okay. Okay. Oh, Henry, I'm sorry, Henry. You look like you were in a really deep slumber there again. But just so we can finish this cranial nerve examination, if you wouldn't mind just staying awake as much as possible. There isn't too much left, okay? And this is going to be very relaxing as well, I assure you, okay? Okay, so I'll just keep looking at you to make sure we don't fall asleep. So, if you just tell me which one, if it sounds louder or quieter in either ear, or about the same. About the same, good. In your left ear, okay. In your right ear, okay. The same, good. couple of tuning forks here. If you can tell me if it sounds about the same. Okay. About the same. Okay, so what I'm going to do, I'm going to place these tuning forks near your ear. You're going to feel the vibration on your face. If you could just tell me when you stop hearing that vibration, that sound, and feeling that vibration. Well done. Well done. Very well done. Okay, soft sounds, soft sounds. About the same. About the same. About the same. Your left ear. Your right ear. About the same. Still just making some soft sounds. About the same again. In your right ear, good. In your left ear, great. And in both ears, excellent. So, Henry, if you can tell me what colour do you see here? Orange, great. If you could tell me what colour do you see here? Purple, thank you. That's very good, Henry, well done. And if you're able to tell me what colour do you see here? Yellow. You're doing very good, Henry. Very good indeed, and I'm really sorry if I'm taking up too much of your time. There isn't too much left, all right? Okay, so you're doing really good, Henry. Very, very, very good. Sure. Enjoy your cigar. Have another cigar. I'll keep smoking that one. Yeah, why not? So what I'm going to do, I'm just going to come very close to you now. I'm just having a little look into your eyes. I'm sorry if this is too intrusive. Okay. Okay, that's good. Just looking into your eyes and around your eyelids. So if you could just look at my finger here, Henry, that's good. Just keep looking. Thank you so much. That's very good. I do apologise for my baguette breath. Just a Marmite baguette, full baguette. Yeah. Okay. Right, that's great. And same again, Henry, but I'm just going to do your right eye now. Okay, I'm just going to a little bit closer. Okay, that's good, Henry, that's good. Okay, just looking here. So if you can just look at my finger here, that's good. Now I'm just checking around your eyelids. That's good. Looking all good there. Very good. That's great, Henry. Well done. I've got just a torch here, okay, a white light on here, just like you to follow it wherever it goes, okay, wherever it goes, keep looking at the torch, wherever it goes, keep looking at the torch, keep looking at the torch, Henry, that's great, wherever it goes, you're doing so good. Really nice to see a patient who's very into this and following all the instructions as required for this cranial nerve. Keep looking at the torch, keep looking at the torch, keep looking at the torch, that's great, you're doing a superb job there, Henry. Great. Keep looking at the torch. Great. Sorry if that was a little bit intrusive there for you. But I'm just checking your pupils and seeing how they interact with light, coming closer and farther away there for you. You're doing really good, Henry. So, what I'd like you to do now is just place out, your legs are comfortable there, okay? So I'm just going to get your knees and do gentle taps on them like this, okay? Just gentle taps. Okay, well done. Well done there, Henry. Just gentle tap there and there. Okay, now if I'm just going to go like that and like that down your leg there, Henry, okay, so, okay, like that. Yeah, it's a little bit close and personal, okay, but there's no need to feel like you need to react any sort of violent way or whatever, Henry, just in case you feel like that. Okay, so just try that again, okay, there we go. And there we go. Does that feel about the same there? Great. There we go. So a gentle tap on the top there and the top there. Good. No, that's all functioning fine. Functioning fine. So what I'm going to do, I'm going to ask you to lift your knees up like that for me. I'm going to try and resist and push them down. Okay. So your right knee. Okay. Left knee. Lift up. That's great. Now I'd like you to put your arms out like this to me. I'm going to push your arms in. Okay. So I know that you're a very strong person there, Henry. I could tell by the look of you. So this is going to be a little bit harder for me than it is going to be for you. Okay, so I'm going to ask you just to put your arms up like that. Okay, I'm going to resist. That's fine. That's very good. Again, so again. Okay, that's perfectly fine. Now I'm going to do the opposite. I'm going to try and ask you to pull them in whilst I try and pull them out. Okay, so if you can just. Very good, Henry. Very good. Doing a great job there. Okay, and I'm just going to try and pull. Okay, perfect job there, Henry. You've done very well there. Very good. Okay, so I'm going to do some gentle taps on your hands like that. Okay, and just put your hands out like that. Look directly at me. That's good. Please do a circle there, a circle there. That's fine. Okay, so I'm just going to do gentle tap there, gentle tap there. So I do have some Joyrider airplane pilots flying around. Okay, right, it's just stuck outside. Okay, just go like that. Okay. Right. So I'm just going to feel around your cranium here. So I haven't any reason to suspect that you've got any issues here. Everything's feeling as it should. Everything's as it should. And just even above your eyebrows there, as you do so well with that, sort of frowning. And your muscles seem quite strong above there, and a lot of frowning. Where you smile, you would make muscles and maybe crease marks here. Yeah, but you don't have any of those. Okay, but certainly at the top there, you must do quite a lot of frowning exercises, so we say. Okay, but that's looking just fine there. Okay, so final things I'd like you to do. I'd like you to draw a funny face there for me, just as angry as you can. That's perfect. Quite scary actually. Okay, and now what I'd like you to do, I'd like you just to blow up your cheeks there for me. Okay. Okay, that's fine. Okay, finally what I'd like you to do there for me, if you can just open your mouth a little bit. That's great. And now what I'm going to do is just place my finger there. I'm just going to do some gentle taps there for me to keep your mouth open there for me. That's great. That's good. Okay, and just clench your teeth there again once again there for me. Thank you, that's good. Now what I'd like you to do is open your mouth as wide as you can, like you're surprised that someone unexpected has come to see you. That maybe you don't like. You do that so perfectly. That's great. You can just close your mouth there. That's really good. Now what I'd like you to do is blow air into your cheeks as much as possible there. That's great. Okay. So I'm going to ask you just one final thing there, Henry. Then we're all fully done with your cranial nerve examination. I'm going to ask you to close your eyes. I'm going to hold down your eyelids just a little bit, a tiny bit of pressure there, but nothing intrusive. I'd like you to try and open your eyes there for me. So close your eyes. Okay. Got my fingers there. Okay. And now if you can just try to open, fight. That's great. Okay. That's really good. Now I'm just going to press up gently around your eyes there. Okay, just pressing ever so gently around your eyes. Okay, perfect there, Henry. Thank you so much. You've done incredibly well your cranial nerve examination. Okay, so final thing, I'd like you to look just directly at me. Okay, that's good. Just keep looking at me. Keep looking at me. Keep looking at me. Keep looking at me. That's good. Keep looking at me. Keep looking at me. Keep looking at me. Keep looking at me. That's good. And just one final. And one final. Henry. So sorry, Henry. You realise you're fast asleep there. I'd just like to say that we've finished your cranial nerve examination there, Henry. You've done an exceptional job, and I'd like to say thank you so much for being so obliging and following the instructions as requested. Okay, so if you don't mind, I'll just quickly write the things down here. I'll write it down as quickly as possible there for you. Okay. So examination. Very well. Okay. Examination. you don't mind me asking there, Henry, what was your age again? Okay. That's perfect. Well, there we go. If you just give me one moment there, Henry. I would like to say once again, thank you so much. No, don't get up. Don't. Thank you so much, Henry. That's very kind of you. I don't know why I won't be too much longer. I'm just saying thank you and goodbye. You've done everything perfectly. Everything is as it should be, and you're looking very healthy. And your cranial nerve examination was perfect all the way through. You even showed really good signs of falling asleep. Snoring not so much, but your sleeping you must be quite tired. Well, I'm going to leave you in your lovely house here. So thank you, Henry, once again for inviting me over to do the cranial nerve examination. It was a true pleasure. Okay. Well, see yourself. We are done there. I guess I'll let myself out. Okay. Take care of yourself. Cheerio.